is Mental Health Awareness Month, and efforts are underway to reach as many people as possible who may be feeling hopeless and helpless.
Here with more on what's being done is the Executive Director of the American Foundation for Suicide Prevention in Illinois, Angela Cummings. Thank you so much for being here.
Thank you so much for having me.
I was astounded when I was looking at the new campaign you guys have, how early kids are committing suicide.
Right. Well, and that's just the earliest that the CDC tracks the numbers. There are, incidences of suicide even younger than age 10, which is very shocking to everybody. But, it just points to the fact that we really need to start early, with public education campaigns such as the PSA that you were just referencing. And just, in our own homes, in our schools, just starting those conversations is so important. And it's not too early to have a conversation if you have a child at home, definitely.
And what does the national data from CDC say about suicide?
Well, unfortunately, we had seen a decline in suicide rates over 2019 and 2020. That was great. It was 2% over those last years. Then we had the pandemic. And that unfortunately did make things kind of U-turn back around, and it climbed right back up that 4% that we had lowered it. So that is a bit of a setback, but what we are taking away from that is that we know that the efforts were working. So we did reduce the suicide rate 2% over those 2 years. A global pandemic is not anything that you can predict, and it had mental health ramifications that nobody could have expected. I guess one good thing about it is the silver lining is that everybody figured out that we all have mental health during the pandemic, because for sure that was what we woke up with every morning. I'm feeling really uncertain and unsteady. That's what mental health is. So it kind of brought it out, into the conversation more, I think.
And it's such this catch-22, because you want to address suicide, but I know at least when I was growing up, people didn't want to talk about it because they didn't want to put that seed in someone's head.
I'm so glad you brought that up, because we know from research that talking directly about suicide does not put the idea in someone's head. And in fact, it is actually a good idea, and it reduces suicides. What it will do is you will not put the idea in someone's head. If they're already kind of thinking about that, or it's become so bad and they're so depressed or so anxious that this idea has started to creep into their mindset, by bringing it out and being very direct about it, it will be a relief to that person. And at that point, they know that you're a safe space. You are someone that they can go to, and you're not going to judge, and you're going to listen, and you're going to help get them to help. And that's the key point. You don't have to be a mental health professional. You just have to ask the question, let them be honest and open, and then help guide them to help. So,
all right. So there's a campaign out there now. It's Talk Away the Dark, and tell us about that and how it can help people to start that conversation that is so very necessary.
So Talk Away the Dark is our new PSA from American Foundation for Suicide Prevention. It launched on the 15th of May. It's going to be a year-long campaign. It's a movie. It's a short little vignette. There are different, versions of it. You can see it at talkawaythedark.org. And it tells the story of an older man and a very young adult woman who is noticing that her father, the older man, is starting to display some of the key warning signs that you might recognize in someone who might be thinking about suicide. And it dramatizes this in a way that I think the viewers can really relate to. It gives her, and then it wraps up with her giving some really, interesting advice to her dad, like, we have to do something about this. We can't keep hiding this. We need to talk. And then you kind of see the lights starting to turn back on in the movie, and that kind of represents, that he's going to get help.
He's getting help. What are some of those key elements that people need to look out for?
Okay, so when people are considering suicide, they typically display warning signs in three main ways: talk, behavior, and mood. And talk can be a couple different ways. Oftentimes people who are suicidal will frankly just tell you. They use words like burden or being an unbearable pain. Sometimes they joke about it though, and that's their way of talking about it in a way that feels more safe. Even if someone is joking about suicide though, you should take it seriously. I'm a suicide loss survivor myself, and that's exactly the scenario that happened with our friend. He was joking and we thought he was joking. So, and then behavior and mood, of course, we all have mental health. It's all existing on a spectrum on any day. But if someone's mood is changed significantly and it's not bouncing back up, if they're engaging in like reckless behavior or not doing the activities that they used to love to do, it's really kind of over time that you want to pay attention to this. And that's when you might want to step in and really ask directly, I'm worried about you. I've noticed these changes in you. Are you thinking about suicide? You can say those words.
Okay.
And so you guys have two events coming up. You can get more information about them at afsp.org/Illinois, but they're virtual events that people can participate in?
We have lots of virtual events because that is another thing from the pandemic that was a real boom. It's like we can do a lot of virtual meetings, and then we have in-person ones as well. So lots of opportunities to join us at that AFSP.org Illinois
Okay.
site.
Also, there's the National Suicide Prevention Hotline as well, that star 988, the crisis line that
Yep.
people can reach out to. So, thanks for coming in and helping us
thank you.
start this conversation, Angela.
Thank you.